for me. Hi! Hi! Wow! Yay! Hi, everyone. Nice to see your beautiful faces. Hi, Marian. Hi, Camila. Oh, si Saison, oh. Hello. Good morning. Hi, Katrina. How are you? Okay, there. Oh, there. There's Gail there. Wow. Hi, Bluey.
Miss.
Kamusta ka mo? It's really nice to see your faces. Um, wala lang. Gusto ko lang ka makita. Hi, Jenny. How are you, Jenny? Okay. So I understand also the difficulties some might be facing because my mobile data and all. But like sa class naman bala, no, kamustahan ta before. And it's good for us to keep that connection. Do you want to tell me something? Yung sinong may knock-knock joke? Knock-knock joke. Wala ka mo knock-knock joke?
Si Peter, Miss Mira.
Si Peter! Peter! Paano naman? Pa-knock-knock.
Birthday yaman na Miss Hangga po.
Happy birthday, Peter! Gusto ko lang yung emoji ako. At, wee! Wala kang online kain. Peter din ka na. Pa-burger ka naman, Peter. Peter, where are you? Happy birthday, Peter! God bless you. Yes, so, di ba? Vikings. Do close man sa buong kalanaan. Di ba, MECQ? Close sa buong. Wala ko kabalo ka na naman. Okay. Sinong may panaknak? How are you? Hi, Peter. So, anong plan mo for today, Peter? Open daw ang Vikings for you lang, Peter. Peter, ano plans mo for your birthday today?
Miss, mapa-enroll.
Ma?
Mapa-enroll sa summer class.
Enrollment na? Subong?
Hasta lang 29, Miss.
Enrollment na subong. Wala pa gani katapos ng SEM doon. Wala ko na yakabalo. My goodness. So breathe in kita tanan. Kilang lang tagurong sa Terra X nila ang klase na bala. Amo na ang breathing. Oh my goodness. So pa-enroll. Open ang school subong ha. Magpa-enroll ka mo. Or online enrollment. Ano? Wala ka mo gana mag-storya nga ha. Manokso. Di ba lang ha? Mag-storya pa kuya. Si Patrick. Hi, Patrick. Jay. How are you?
Hi, Miss.
Anong ganap? Anong mga ganap? Good morning. Anong ganap? Jay?
Nothing much man, Miss.
Nothing much. Sige, okay lang na. At least, hindi siya extremes, no? May ganap at wala lang.
Class na, Miss. Non-stop na class.
Class. So, feeling ko, looking at, daw, toxic positivity, but, depende na, So, at least may, may opportunity to learn and go to school. Si Francine, bala nakita ay kami sa, Francine, ari ka de? Are you here, Francine? Kita ko si Francine, naka-get up siya sang Sunday.
Yes.
Hi, Francine! Good morning! So, haggard kami sang Sunday, kaya wala sang mall. Galing may pasulod sa amin sang Sunday. Joke lang. May errands kami. So, lagaw-lagaw lang pag may time. May okay kasulod ka mo, no? Doon hindi na ka mo subong kasulod girl sa mall. Ay, hindi. Kay over 18 ka mo gali. Pwede ka mo gali. Pwede. Sige. So, anyone wants to share before I start? Sino ang nice hair? Sinong may nice hair? Si Peter. Wala man lang turn on. Come si Peter. Good morning. Pa-burger si Peter. Mapa-enroll na. Oh my goodness. Sige. Si Katrina. Hi, Lima. How are you? Kumusta
Hi,
ka?
Miss. Morning.
Morning. Si si Kiana. Sino na Kiana? Sa imo nga profile pic.
Morning, Miss.
Okay. Uy, butang yung bala ninyo, profile pic, bala sa inyo, nga mga para, it's difficult to remember and I really want to remember Gidea, everyone. So let's start. Okay, so let's start. Okay. So basically, you had to do the activity on your own first, but with peers. So the reason why is, of course, you have to know first how to do it, and then we'll walk you through it. Amo ni siya gali, pero amo ni siya ginapanumdum kuya earlier. Pero amo ni siya gali, no? Or pwede man amo ni. So amo na siya dapat ang train of thinking naton. Hindi nga, anong tsakto, anong sala, no? So ang atan really purpose is, ano ni siya, and amo ni siya kaginang ginapanumdum ko, and then amo ni siya gali or pwede man amo ni. Okay, no? So that's how we should be thinking as we go along for today's lesson, and hopefully walang brown out, no? And so yes, wait lang, ibrahon ko. So yeah, so I'm gonna be sharing a screen, and then we will talk about Mang Jose. Si Mang Jose, good man. Can you see my screen? Let me know right away if you don't. Makita niyo akong screen. Yes, kita ko siya. So let's review the case first, no? So Mang Jose is 60 years old. He fractured. He encountered an injury while at work, and that eventually led to him developing cervical radiculopathy or CR. And then at this point, he is complaining of a intermittent radiating pain with paresthesia on the left upper extremity, specifically on the fourth and fifth digits, tolerable pain. So he said that he had difficulty functionally, no? So he had difficulty lifting, he had restrictions in motions, and he had a problem with posture. So this is Mang Jose. So example lang. No? And so this is what's happening, no, with what might have happened, no. So assuming, so because of the injury, there's narrowing, and then there's yeah, the impingement might have caused the radiculopathy, and because he has a specific area where he's particularly complaining of pain. So in this area here, so that's like ulnar nerve, so distribution. So we have C8. So when mag-look back kita sa aton anatomy and physiology, so these are the distributions. Most commonly is C6, C7, pero less common ang C5, C8. But hindi siya hambal nga it wouldn't happen. But less common lang siya. But in the case of Mang Jose, it's C8, this distribution here. Is it clear so far? Clear pa? Is this also what you read, or did I post a different case?
Yes, Miss.
Yes. Okay. So other things that we want to consider are things that might influence healing and cellular and tissue level would be that the fact that he has hypertension and type 2 diabetes, and he is taking medications for the comorbidities that uh, he stated. Okay. So so with when we think about our patients, when we think about our patients and we think about their current situation and their medical diagnosis, we would want to, syempre no, di ba, hindi ta na memorize tanan, no? We have an idea, about neurologic, cardiac, cardiopulmonary, orthopedic, musculoskeletal. But basically, we don't like pagka abot sang pasyente, may ara ka na dayon, no? Isang idea. So what we usually do when we incorporate evidence-based practice is really what we do. What do we do? Treat dayon. Ma-treat kita dayon. Hello, everyone. Assess, yes, no? And what would include that assessment? Pwede ka naka-EBP at that point sa assessment pa lang. Pwede ka mo kahambal, kabudlay siya daan kung nag-read man ko di sa chat box tapos nag-alanta ko di sa mga stuff. Pwede ka apply EBP sa assessment pa lang. Sino ni siya? Si Brian. Brian, ikaw eh? Brian?
Oo.
Can you speak louder?
Hello, Miss. Bation ako.
Okay na. Batian na. Brian, so the answer is yes or no?
Yes, Miss.
Yes. Yes what? Yes, you have to complete the sentence. Yes.
Yes, evidence-based practice could be used in assessment because you could find studies to inform you what are the best tests that you could use to assess the patient's condition.
Very good, no? So, all throughout the PT process, thank you, Brian. So, all throughout the PT process, EBP should be conscientiously applied. But silingon, intentional, kaya consciously, mag-go back, kagito sang palibot-libot, nga process, no? Sa all throughout the PT process. So, I hope that that's clear. So, at initial assessment, pwede na dayon, no? EBP ka na dayon. So, what we're thinking here, so balanta nga may aras ang cervical radiculopathy si patient, no? So, how are, manumdum ka din. So, how are patients with this type of condition managed? Should you go to literature, no? So, you'd go to literature. So, usually, no, they can be managed through invasive procedures such as surgical procedures or so non-conservative siya, no? Non-conservative invasive. So pwede siya may bone graft, pins and screws. So may ara siya da sang or pwede siya conservative pero invasive, no? So mga ba kita conservative pero invasive, these are used pwede ni ang injection therapy, no? So syempre hindi na yung aton line of work, no? So pero this is how one way of treating also patients with cervical radiculopathy. And then, what are other ways? So, pwede siya, again, pwede siya conservative, non-conservative. So, kung non-conservative mo itong surgery, kung conservative, pwede siya injection therapy, which is invasive or non-invasive, such as use of patient education and traction. No? So, pwede siya, traction, patient education, passive modalities. So damo siya sang mga ginahambal sa literature nga pwede to use along with exercises to treat cervical radiculopathy. So traction can be applied mechanically or manually. Okay, so familiar man kamo sa traction? Yes or no?
Yes.
Yes, okay. So wala siya balik na record ang atong session. Wait lang, okay, basic ko.
Recording in progress.
Okay. So again, so you have to find out first, no? So again, so as therapists, so sa tanan do nga gin-mention, ang aton nga option would be conservative and then